All right, so the next chapter that we're gonna cover is workforce safety and wellness. All right, let's get straight into it. All right, so for this particular chapter, we're going to look at standard safety precautions, personal protective equipment, stress management, dealing with death and dying, prevention of response-related injuries. Going to be looking at lifting and moving patients, prevention of work-related injuries, disease transmission, and wellness principles. Introduction. To take care of others, we must take care of ourselves. Very important. AEMT training includes the recognition of hazards. So you need to be looking out for personal neglect, health and safety hazards, and stress. It is a stressful profession. Self-control. This is necessary to respond effectively to the suffering of others. Hold on. Slides will be available, Mr. Linton. You'll have access to the PowerPoint. So again, an introduction. Self-control necessary to respond effectively to the suffering of others, developed through training, experience, and dedication. Infectious diseases. Infectious diseases is a medical condition caused by organisms within the body. A communicable disease can spread from person to person or from one species to another. So all communicable diseases are infectious diseases, but not all infectious diseases are communicable. Some are communicable. Infection risk can be reduced by immunization, and there are certain immunizations you're expected to have if you're going to work in the EMS field. Protective techniques and hand washing. When protective measures are used, the risk to provider is negligible or reduced. Proper cleaning and disinfecting of the ambulance and equipment will help prevent transfer of illnesses between patients. Inform other providers who may come into contact with a patient of potential risk. Discretion is imperative. Include all patient history in written documentation. Now, routes of transmission. All contagious diseases are infectious. Not all infectious diseases are contagious. Infectious disease is caused by an infection. A pathogen is a microorganism that is capable of causing disease in a host. Contagious diseases can be transmitted from one person to another. It can be from direct contact, blood, indirect contact, needle sticks, airborne transmission, sneezing, foodborne transmission, contaminated food, vector-borne transmission, fleas, or mosquitoes, or other type of insects. Routes of transmission. So look at what is poor, acceptable, best. And that's for airborne. All EMS personnel are trained in handling bloodborne pathogens, approaching patients who may have infectious diseases. You need to think about the appropriate PPE that will be necessary. Don't put yourself or your crew members at risk. Training is required by OSHA. The CDC develops standard precautions to prevent workers from coming into direct contact with germs. The assumption is every person is potentially infected. Notify designated officer if exposure occurs. Proper hand hygiene, simplest, most effective way to control disease transmission. Wash hands before and after patient contact. Make sure you clean your personal equipment as well. Your pen, your stethoscope, your pen light, stuff like that. Use hand washing substitute if there is no running water. Gloves, minimum standard for EMS personnel. Both vinyl and latex are effective. Change gloves between patients. Protect hands and wrists from injury during rescue. Eye protection. So eye, nose, and mouth protection is going to be necessary if you're doing airway management procedures, or you're interacting with a patient with signs and symptoms of upper or lower respiratory tract infection. A lot of these communicable diseases will present as if the patient is having the cold or flu. So eye protection protects from blood splatters. Goggles are best. Prescription eyeglasses are not adequate. Face shields can also provide some level of protection. Gowns provide protection from extensive blood splatter when used with other PPE. You may or may not have time to put on a gown. May be worn in situations such as field delivery of infant or major trauma. Not practical in many situations, may even pose a risk for injury. Mask, respirators, and barrier devices. Use standard surgical mask if fluid spatter is possible. Place surgical mask on patient with communicable disease. Use mask on patient and HEPA respirator on yourself if tuberculosis is suspected. And if you're going to be using a HEPA mask, it needs to be fit tested and it needs to be seal tested before you start wearing that mask, because the mask needs to fit the shape of your face and it must be able to provide a proper seal. Mouth-to-mouth resuscitation may transmit disease. Use pocket mask or bag mask device. Devices are contaminated after exposure to patient. Dispose of according to local guidelines. So do not reuse these equipments. Proper disposal of sharps help to avoid HIV and hepatitis. Do not recap, break, or bend needles. Use needleless systems and IV catheters with safety systems. Dispose of used sharp items in approved, closed, puncture-proof containers. Employer responsibility. Your employer cannot guarantee a 100% risk-free environment. Risk of exposure to communicable disease is a part of an AEMT's job. Your risk for infection is not high. Employers should follow OSHA and other regulations such as CDC and NFPA. Know and use department infection control plan. So the department must have an infection control plan, and you need to be familiar with that plan. Establishing an infection control routine. Infection control should be a part of your daily routine. Clean the ambulance after each run on a daily basis. Cleaning should be done at the hospital whenever possible. Immunity. Even if germs reach you, you may not be at risk for infection. Immunity comes from having been immunized or vaccinated or recovering from an infection of that germ. Sometimes immunity is only partial. Humans cannot form immunity to some diseases. Preventative measures. Maintain your personal health, receive immunizations, get a tuberculosis skin test yearly, and if it is positive, you need to do a chest x-ray. Always follow standard precautions. You will not know which patient have communicable diseases. General post-exposure management. If you are exposed to a patient's blood or body fluids, turn over patient care to another EMS provider. When safe to do so, clean the exposed area, rinse eyes if necessary, activate your department's infection control plan. Early activation is the best way to reduce risk. Illness and injury prevention. AEMTs can be involved in prevention. In most areas, EMS providers are considered high-profile role models. This table 2-4 shows the top 10 causes of death in 2015. Number 1 is heart disease. Number 2, cancer. And number 3 is chronic lower respiratory disease. 4, unintentional injuries. Interesting. So that's a chart you can pay attention to. And Google or research what are the top 10 causes of death in Jamaica. So that's, and compare it to what is the top 10 in the US. That might be a nice little research for you to undertake. Scene safety and personal protection. Begin protecting yourself as soon as you are dispatched. Wear seat belts and shoulder harnesses. Ensure equipment is restrained. Put on the appropriate PPE as needed. Continue to protect yourself once on scene. Make sure the scene is well marked and well lit. Place warning devices. Park at a safe, convenient distance. Check vehicles' stability. Scene hazards. Hazardous materials. Identify what you can from a distance. Remain uphill and upwind. Use the DOT emergency response guidebook. Do not enter unless it is safe to do so. Vehicle collisions. Some of the most unstable and potentially lethal situations exist during vehicle collision. Consider traffic hazards. Park so you can easily leave the scene. Be conscious of the flow of traffic. Be alert for hazards. Use full protective gear. Electricity. Look for down power lines, and if they are present, this is beyond your scope of training as an AEMT. So you need to notify the power company to turn the power off. Mark off a danger zone. Do not approach down wires. Lightning. Threat through direct hit or ground current. A repeat strike can occur. Stay away from drainage, ditches, moist areas, small depressions, and wet ropes. Move to the lowest possible area and avoid projections. For fire Hazards include smoke, oxygen deficiency, toxic gases, explosions, building collapse. Be trained in use of airway protection and have it available in a vehicle crash. Fuel and fuel systems are hazards. Violence can be created by civil disturbances. It can be domestic disputes, or it can be crime scenes. When several agencies respond, know who is in command. Do not disturb crime scene evidence unless absolutely necessary. For behavioral emergencies, emergencies that do not have a clear physical cause. Emergencies that do not have a clear physical cause are considered behavioral emergencies. Evaluate the patient in terms of behavioral or psychiatric emergency that may lead to a violent patient reaction. Protective clothing, preventing injury. Inspect clothing and gear. Become familiar with various types. For cold weather clothing, it must have 3 layers. For turnout gear, should protect from heat, fire, sparks, and flashover. Gloves protect from heat, cold, and cuts. Helmets protect from falling objects. Top and side impact protection must be present in the helmet. For boots, it needs to be steel-toed. Well, don't necessarily have to be steel-toed, but that is preferred. Leather or water-repellent fabric. Eye protection, glasses with side shield during routine care, face shield and goggles when using tools, ear protection, soft foam industrial type earplugs, skin protection, sunscreen with a minimum rating of SPF 15, body armor, ballistic resistant or stab resistant armor. Stress. EMS is a high stress job. It is important to know causes of stress and how to deal with them, and to be familiar with general adaptation syndrome, which the provider goes through a series of reactions. So there is an alarm response to stress, then there is reaction and resistance, and then there is either recovery or exhaustion. There can be physiologic signs of stress, which include increased respiration and heart rate, increased blood pressure, cool, clammy skin, dilated pupils, tense muscles, perspiration. Stress reactions. Acute stress reactions occur during a stressful situation. Delayed stress reaction manifests after a stressful event. Cumulative stress reactions is the result of prolonged or excessive stress. Acute severe stressors are sudden, severe, and unusually stressful. They can be emotional, such as mass casualty incidents, serious injury or trauma, traumatic death of a child, crash with injuries caused by emergency services provider, death or serious injury of a co-worker. Post-traumatic stress disorder, PTSD. This is characterized by re-experiencing the event over responding to stimuli that recall the event. Sorry, let me read that again. PTSD is characterized by re-experiencing the event and over-responding to stimuli that recall the event. Other symptoms include depression, startle reaction, dissociative episodes. So these are responders who have maybe experienced a bad call, and there are events that are triggering the recollection of that call. So, and each time the recollection is triggered, it affects their ability to function normal. Results from failure to resolve traumatic stress or grief. So if they can't get over that traumatic stress or grief, then the PTSD will continue. Recognizing stress. It is critical to recognize the signs of stress, which may be subtle. Warning signs include irritability toward co-workers, family, friends, inability to concentrate, difficulty sleeping, increased sleeping, or nightmares, sadness, anxiety, guilt or hopelessness, loss of appetite, isolation. Stress management, tactics that alleviate stress reaction. Change work hours or cut back on overtime. Talk about your feelings, seek help if needed. Try to adapt a relaxed philosophical outlook. Minimize physical response to stress. It's not the event, but the person's reaction that determines the level of stress. And for me, I leave work at work. So when I come home, that's it. Unless I need to discuss something specific, but I leave work at work. And my stress, de-stress mechanism is exercising, doing martial arts, reading, manga, or drawing. So something completely different from EMS. That's how I control my stress or release my stress. Critical incident stress management. Developed to address acute stress situation, potentially decreases PTSD, and it's debatable whether or not this works. Can be formal or at an ongoing scene, includes diffusing and debriefing sessions. So this is usually done, I believe, 72 hours after. It's not a favorable method because there is concerns for victimization, and that might not help someone who is having PTSD. Burnout, exhaustion of physical or emotional strength. Symptoms of impending burnout includes chronic fatigue and irritability, lack of desire to report to work. Try to adopt a relaxed philosophical outlook, feelings of being overwhelmed, overeating, smoking, or abusing drugs or alcohol. Preventing burnout. Take care of your own health. Learn how to relax. It's important that we know how to relax. Do not make unreasonable demands. Debrief after tough calls. Peer support and suicide prevention. Recognizing that you or your colleagues are becoming overwhelmed is important. Understand and select strategies to deal with stress in a constructive manner. So yes, needs to be constructive, but different methods might work for different individuals. If you or a colleague expresses any suicidal ideation, seek help. Make sure they get help. Wellness, nutrition. Eat nutritious food, regular, well-balanced meals, several small meals. Hydrate adequately. Water is best. Avoid sugary drinks. I don't think I drink enough water. That's something I'm trying to change. Exercise and relaxation. So practice relaxation techniques. I practiced meditation. So for about 15 to 20 minutes per day, I meditate. I usually do that before I start my martial arts workout. Exercise regularly, ideally 3 times per week is acceptable. Should incorporate strength training, cardiovascular workout or aerobic type workout, and flexibility. So any type of exercising you're going to be engaging should have aerobic type activity, strength training, and flexibility. And it need to be balanced. If you don't smoke, don't start. Sleep regular and uninterrupted. So you need to get your rest. Quality, no length of time is important. So sleep until you feel rested. Disease prevention. Know your family's health history. Adjust your lifestyle if necessary. So if you know that there's a chronic health problem based on if that runs in your family, do what you need to do to ensure that you don't put yourself at risk. Balancing work, family, and health. Find a balance between work and family. That is important, extremely important. Rotate schedule and take time off when possible. Seek help if you are experiencing significant stress is what that should be. So that slide needs to be corrected. Workplace issues. Diversity on the job. Each person is different. Communicate respectfully. Use cultural diversity as a resource. Learn to relate effectively with other cultures. Recognize that there are legitimate differences in how various cultures respond to stress. So respect other people's culture, especially if you're looking to work outside of Jamaica. That's going to be very important. Sexual harassment, unwelcome verbal or physical conduct, or an overheard conversation, quid pro quo, or hostile work environment. I think quid pro quo mean something for sexual favors. I don't remember. I need to double check that. You can also double check it. Perceptions, no intent matter. Keep lines of communication open. Report harassment to supervisor immediately and keep notes. Substance abuse. Increased risk and tension on the job can lead to poor treatment decisions. Seek help or find a way to confront addicted coworker. Allowing it to go on is a hazard to the public. EAPs are often available. Death and dying. Death is likely to occur somewhere other than the home, quite suddenly or after a prolonged terminal illness. The AEMT will face death. So once you're working in EMS, you're gonna have to face death at some point. Stages of grieving: denial, anger, hostility, bargaining, depression, acceptance. Working with family members. Use special care with dying patients and family members. Be concerned about their privacy and wishes. Be honest. Ask how you can help. Do not say you know how they feel. Allow the patient or / family to grieve. Maintain a professional attitude. Working with the patient. Dying patient knows death will happen, may feel threatened. Do not make light of the patient's pain and or fear. And table 2-10 shows concerns of the dying, critically ill or injured patient. So anxiety, pain and fear, anger and hostility, depression, dependency, guilt, mental health problems, receiving unrelated bad news. Now, dealing with the death of a child. This is a tragic and dreaded event. Help the family through the initial period after the death. Acknowledge the fact of the death. If possible and appropriate, let the parents hold the child. Do not overload parents with a lot of information. Right? Caring for critically ill and injured patients. Let the patient know who you are, very important, what you are doing. So who are you? Why are you there? What you intend to do for the patient. Let them know that you are attending to his or her immediate needs. Avoid sad and grim comments. Give patients the opportunity to express their fears and concerns, and don't cut them off if they're talking to you. Respect religious customs and patient needs. Orient the patient, be honest. Deal with possible initial refusal of care. Allow for hope. Locate and notify family members. Injured and critical ill children. Care for as you would an adult. Ask a responsible adult to accompany a child. Uncertain situations. If it is unclear if a true medical emergency exists, contact your medical control about the need to transport. Many minor signs may be early indicators of severe illness or injury. If in doubt, acquire patient consent and transport. And that brings us to the end of this chapter.